Okay, so now we have hoof and digit surgery. I'm not really sure what this is going to go into, but oh, okay. It's a bit like the shoeing procedure, I suppose. So preparing for digit surgery. So I imagine like observation and trimming, x-rays, funnel-shaped opening of the hoof foot. We'll see what that's more about. How to resect the deep digital flexor tendon. This is very important for, I think, navicular syndrome, if I'm not wrong. Don't take my word for that, but like look at the navicular and laminitis slides. Arthrotomy of the coffin joint, horseshoeing after foot surgery, extirpation of the hoof cartilage. So you have two methods that are definitely going to come up in the exam, Povashenko and Mueller-Frick. And this is for the hoof cartilage, and cutting the hoof wall when ossifying the hoof cartilage, and how to do surgery in hoof wall cracks. So what does preparing for digit surgery mean exactly? So basically it includes fixing the animal in place, depending on the intervention, and preparing the hoof. So obviously if the surgery isn't as major, you know, you don't need to fix them that much. Sometimes you need to put them under general anesthetic. And the horses are, and you prepare the hoof. So the horses can be fixed in an upright position with, let's say, appropriately fixed limbs. So this lady's using a stool here. And if necessary, on the operating table in lateral recumbency with the diseased hoof lying on top, obviously, because it's easier to access and easier to carry, or not carry, but to support. So yeah, in terms of anesthesia, you usually use conductive local anesthesia, light sedation, inhalation, or neurolept analgesia. It really very much depends on if they're here, lying down, or standing upright. And in the final stage, you also need anti-tetanus serum to be administered prophylactically, because obviously tetanus is possible in this process, and of course antibiotics. So what does funnel-shaped opening of the hoof foot even mean? Let's do it. Let's go here. Okay. Ugh, gross. So it's in a case of, say, bruise, pricks. So this is like an indentation, maybe foreign objects have come there, incorrect nailing of the hoof, fistulas and openings. So everything I just said is when we do funnel-shaped opening of the hoof. So with a sterile hot knife, you create like a funnel-shaped hole. I think it's here, and it's made by circular movements in the area of the hoof foot. The hole reaches the sole corium, so I assume that's what the black bit is, and the horn is then cuted until it reaches healthy tissue. And in pricking, so like nails, wires, stones, so I guess this is to remove some foreign object like here and here, the hole is made in the same place. And if there's incorrect nailing, if you do this procedure, so the funnel-shaped opening of the hoof foot for incorrect nailing reasons, you have to widen the channel in the white line. I don't remember what that is, but I said it in the anatomy video, until it reaches the corium. So it creates the chance for exudate to drain with infection. And if you have purulent inflammation, so, you know, exudate is pussy of the corium, the opening is made in the front part of the hoof, so near the toe. Although it's showing it sort of here for some reason in this picture. So let's focus here. And it's next to the white line. This is the lowest part where the purulent exudate moves and collects. Yeah, it makes sense for it to be towards the toes, because imagine the hoof is always like this, not like this. So imagine all the pus is going to drain in that direction. And if there is already a pathological opening, so a fistula of the foot, you can use surgical tweezers or a sharp hook. And yeah, of course, you remove any necrotic tissues as well. Now with funnel-shaped openings, they serve to drain the exudate, as we mentioned, to remove necrotic tissues, and for immediate medial treatment of the corium. So this could be a question like, why do we do funnel-shaped opening? Resection of the deep digital flexor tendon. Now this is definitely more surgical, let's say. So why do we do this operation? It's for diseases like prick, purulent inflammation of the hoof bursa, tendon necrosis, and it's performed by low access, low resection. So obviously it's performed under general anesthesia. You're cutting a part of a muscle after all, so yeah, they can't be awake for that. And an area of the foot horn measuring 3 by 3, it says, centimeters, in the area of the frog is removed. So this is 3 by 3 centimeters. And then what you have is underneath it, you have the foot corium and subcutaneous tissue. And then the flexor tendon and navicular bone are located below the access made. And basically 1.5 by 1.5 centimeters, so before it was 3 by 3 to open it, 1.5 by 1.5 centimeters of the tendon is cut, excised in partial resection, and the wound is constantly flushed, say with like chlorhexidine or something. And at the end of the intervention, you put a pressure bandage and you change it daily for a few days. And when you don't have any exudate, the dressing is changed every 72 hours. So you need to change it every day when there's exudate. And yeah, orthopedic surgery is performed only if necessary. So this is surgery before we had shoeing. Now this is arthrotomy of the coffin joint. If I'm being totally honest, I'm not sure what I'm looking at, but it's performed when there's purulent inflammation, so pus, and you have low or high arthrotomy performed. So low arthrotomy begins with access. So if there's a low resection of the deep flexor tendon, the impar ligament can also be cut between the hoof and the navicular bone, which is 2 to 3 centimeters wide. So the exudate from the joint can flow freely. So it's quite similar to what we said, but instead of just cutting the hoof to drain it, you're cutting the tendon itself. And yeah, in high arthrotomy, so that was low arthrotomy. In high arthrotomy, it's an operative access. The way it works is you create, it's very hard to see here, but you create a horizontal incision above the hoof, 1 to 2 centimeters long, on the side of the extensor tendon. So it's usually, I assumed it was at the front, but I could be wrong, in the anterior articular diverticulum, just above the hoof border. And when there's maximum contraction of the hoof and stretching to the opposite side, the incision and the joint cleft is expanded, and this helps to make any medical manipulations to be performed. It also mentions horseshoeing after surgery, so I think what I'll do is stop here and we'll carry on after.